we're working on is completely open source. Therefore, anyone can participate. And we've built a global community of 500 plus volunteers that are contributing in their own way. So clearly that stresses the organization, especially a young organization as any startup is. But at the same time, we're happy to be stepping forward and trying to help humanity a little bit here, flatten the curve.
Guys?
One of the things we do is we've been analyzing social attitude and communal activation for the last 6 years. So we're ahead of the curve in the way of what we're trying to sell. COVID-19 came along and basically made everybody who needs publicity, who need to manage public opinion, realize they're not prepared. So we're not profiting off COVID-19, but we are ahead of what everybody else is doing. So now the rest of the world is catching up to realize we need new tool, we need data to manage public perception. And some countries are finally taking foreign influence operations seriously. So they're looking at how can we really make sure everything our citizens read have some sort of foundation basis. So this is where we never want this to happen, but our mentality, our product has been oriented toward this for years. So this is an opportunity for us, but we're making sure all the government have free access and zero setup to getting these kind of alert because they needed to manage their country at this critical time.
Yeah, Dr. Lau?
Sure. So probably I'll come from the angle of lead and also coronatracker.com perspective, right? So from the angle of lead, we have been providing courses, trainings, online and offline. So we sort of offer a hybrid model because most of the time people here, especially Southeast Asia, they are still not so used to online training, but we do want to cultivate that sort of habit. So we do provide hybrid models so that they can take their course offline and then they can take their revisions and participate in the others discussions or group meetings online. So that's one part of it. So from an online training point of view, I think apart from like what Bobby said, right? Food delivery, online shopping. I think online education is another industry that we have seen an uptrend instead of downtrend or stagnant. Now, coronatracker.com itself, I think that itself is like a startup. So I always believe that every company should be a social enterprise to a certain extent, right? Although in the startup context, we do have a clear definition of what not. But coronatracker.com itself, since day one, we have open source it, and like Roger said, it doesn't mean that when you are providing open source solutions and when you are giving information to help people for free, it means that it is not making money or is not sustainable to a certain extent. So if you guys, if any one of the startup entrepreneurs who would like to make sure that your startup sustain during this critical period, you can look at our model. I mean, the whole journey is a story for another day, but you can look at how we scale from 1 users to 100 users and to 5 million users today and serving 10, 20 millions of views. Yeah. So I think that's something that you guys can think about. And another thing is people always say, data is a new oil, which I think given the oil price today, which is somewhat true, right? So definitely you can look at data in the sense of selling crude data, selling raw data I would say is the worst idea. But how do you refine the data and extract insights, like what all three of us are doing here, is something that every startup entrepreneur should start thinking about. Thank you.
Yeah, so just like Dr. Lau said, oil is the new data, but insight and intelligence is the new face mask.
Exactly.
So basically, it's data scientist's wet dream this period of time. Okay, Roger. All right. Now that, for example, on social media, you see a lot of fake news. You see a lot of news. You see a lot of inaccuracy. You see a lot of people talking about it. So I'm going to dive into this topic of what you guys are doing and to go to you to reflect on what are the things that you have seen so far and how you are able to use your platform, or for that matter, governments that can use your platform to say that, hey, how to, for example, contain any kind of breakout?
Sure. We started this.
Is this the one you need?
Yeah, this is the one we need. Okay. So I'm from Taiwan, and Taiwan very early on took measure. This is all the posts from Facebook. If you can see, all news related to COVID virus started very early in January and has been consistent throughout the entire period. Media saturated coverage, fairly robust content. If you look at this, is the behavior index. This is when people get angry about news. So we actually have behavior indexing show you. As you can see, this is where somebody claimed that self-isolation is like being in prison. But overall, the anger level is fairly consistent and trending downward. In the perspective of government, the government has good communication. People are accepting of the situation, and compliance with public order seem to be very stable. What really concerns me is if you look at other countries. So in January, Taiwan started taking very decisive measure. Let's look at, this is Malaysia. Throughout the entire January, very few mentioned. And you started getting a media saturation very late. And the anger level is unstable. This is a huge concern because Malaysia is just entering the incubation period, and the public awareness is very low, yet the emotional reaction is very high. We see the same trend with Thailand. Very unstable media coverage and very unstable emotion. When we look at Indonesia, India, same thing. Indonesia, same thing. So what we're seeing from the data, we're seeing a lack of public awareness and very strong anxiety. So the situation and the emotion and the message are not being managed. Whereas when we look at Vietnam, took decisive action very early. These news are about foreign countries. If you look at the emotion, it's still reacting to the news, but it's fairly stable. So Taiwan and Vietnam, early decisive action, strong communication, consistent management of the message and behavior are indicating that they have it under control. Other country is a lot more concerned.
Can you show some of the points that sort of like that
sure.
tells you a story?
Which country you want?
Let's talk about Vietnam.
Okay, so let's look at the highest anger level, so we can actually see the original content. So this is I have no idea what this is because I don't read Vietnamese.
Okay.
So this is where this content is generating the most anger reaction on Facebook. So we're using behavior to tell policymaker what's the flashpoint because it's just too much content for human to read. So we use these behavior markers to make rapid decision about Bobby?
Okay. Okay, let's use something from Singapore, let's say.
Singapore, I don't have take a few seconds. I don't have that up yet. Let me get it.
Okay,
so this is the US.
Let's say common language. Okay, US.
This is the United States. So
okay, what does it mean when you see this flat graph, and then all of a sudden you see that three hill of spikes?
These are just the number of posts about COVID virus, Wuhan virus, or what Trump called.
Right.
Yeah.
Okay.
So these are just content. What we really want is emotion. So these are the anger level. So this is where, as of yesterday, this is the highest anger level post that triggered the anger level. So this is how government and corporation use typically to understand how the audience or the consumer or the voters are reacting. So this is where it's very easy to make decisions where to deploy your public relation or propaganda resource to manage a specific issue.
Right.
So we're going through about almost half a petabyte of data right now, so it's a bit slow.
Right.
So this is how we're providing this kind of alert for government free right now. And we started this because we were doing analysis for Middle Eastern. So Donald Trump, this is generating the most anger, not a surprise.
Wow, what a surprise!
And
who would have thought?
based on the media coverage and the behavior, the unstable behavior, I'm not confident the U.S. can contain the epidemic.
You are confident, or you're not confident?
I am not confident that the containment will work. And
okay, all right.
This is not even factoring other data, just purely from the raw emotional reaction. Some countries are going to have a very, very rough path ahead of them, and containment may not even be possible in some countries.
Okay, hold that thought. All right, let's go to Das.
All right.
Thank you, Roger. Hold that thought, and then we'll come back to that. I think that's a really interesting point. Not because we want to talk bad about the country, but I think US is really important from an economic standpoint. So hold that thought. Okay, Das.
All right. So I will share a little bit about what we've been doing here in regards to the particulars of the effort we're working on for what we're calling Private Kit and Safe Paths. Do you see my screen?
Okay, I'm clicking on now. No, hang on. Okay, Roger, can you take your screen off?
Yeah, sure.
Okay, and that's right at the bottom. You can. Okay, yep, I got it. Okay,
fantastic.
Yeah.
So this is an overview of what we've been working on. So we saw in early March the reaction from all these countries, and we knew that it was going to be a big deal in the US. We knew that we expected at the time 70% of the population will get it in the next year. So as a response to that, we felt that it was urgent that we come up with a solution to track the disease or the how widespread the disease is in a completely private way. Because if we don't do something, it is very likely that the government of the United States would probably have come up with a surveillance state solution. So therefore, our goals were to make it free and private. And part of getting the population of the United States, as well as other populations in other countries, to try to gain trust in this application is to make it open source. So we started with a brand new application. We made it free and open source and private by design in a way that enables the entire citizenry of the country to work towards flattening the curve. So therefore, we started the effort, and it's called Private Kit, and Safe Paths is a tool built on top of Private Kit. And what Private Kit does is enable digital tracing solutions for public health in the short term, right? So how do you determine if you have been potentially exposed to the virus? And then therefore, how do you make an educated decision as to whether you need to seek medical care or attention? Or do you instead just self-isolate or self-quarantine, depending on how severe what you feel? In the medium term, we think it's imperative that we work together to restart the socioeconomic activity in a country. And over the long term, what these solutions can enable is to build strong, resilient societies and communities. So the particular app is a partnership between Triple Blind and MIT. MIT is the publisher of the app on the Play Store and the App Store. What it does is logs your location in real time, and periodically it downloads from health providers the data from infected trails. The phone then performs a technique called private set intersection, which is a privacy-oriented cryptographic technique that enables you to determine if you have overlapping points with another set of overlap with another infected trail. In doing so, you learn nothing about the people that were infected. You do not learn where they live. You do not learn where they might have gone. All you know is at 12 p.m. on Monday, you might have been exposed to someone with coronavirus. You came into close contact with them possibly. And so therefore, the symptoms you might feel in 14 days, for a period of up to 14 days, might be related to the virus. This is motivated in particular, for example, by patient number 31 in South Korea, if you guys are familiar with that, where one patient infected well over 2,000 people. And the authorities had to manually go and trace 1,160 contacts by that person to determine who this was in the sphere of influence for that particular person. So the question we asked ourselves was, how do you prevent and track such community spread without building a police state? So therefore, what we built is this private kit tool, and on top of that, there is a safe places redaction tool. So it allows the exporter, the user, to be able to redact specific data points that might be either embarrassing or reveal too much about them. We automatically strip out data about where you might sleep at night, and where you might work. So those patterns of behavior are anonymized and removed and statistically guaranteed to be private. And then on top of that, we present a faster and more accurate way for the healthcare providers, the decentralized healthcare providers, to be able to track community spread. In the United States, the problem we have is that it's a bottom-up society. What that means is, if someone is infected, it is the county that person lives in that is responsible for interviewing the patient and determining where they might have gone the last 28 days. And the best tools they have today are all completely based on recollection from memory, right? The person asks you, where have you been the last 28 days? And tell me, to the best of your recollection, who you might have met. And based on that, we will try to analyze who we need to go protect from this disease. And so this is not just a privacy tool to track COVID, but also a tool for the community health officials to be able to determine who else to go protect. The app is live on the App and Play stores, the App Store being the iPhone App Store and the Play Store being the Android App Store. And we invite collaborators from around the world to participate. We need a lot of help. We have about 500 people that have been engaged on this. A lot of them are MIT students. A lot of them are also Harvard Business School and Harvard Kennedy School students. Triple Blind is doing all the technology behind this. And we have participation from the governments of India and Chile and Spain and Italy and obviously the United States, as well as the WHO, CDC, and HHS, and several other health administration departments. But it's important to realize that we're doing this completely in a decentralized way without building a community or a surveillance state. So this is it.
Okay. Okay. So put it in a layman's term. So I have your app, and let's say I'm currently in, let's say, New York, right? And I'm walking around. I shouldn't be walking around, but let's say I'm going to, Gristedes, okay, for some shopping, right?
Right.
And so my Bluetooth is on, and it's tracking people around me with phones on, for example, right? So obviously, I'm not going to monitor my phone or the data every second of the way. So I have it in my pocket. I get home, and then I turn on the app, and I see what's around me. Is that how it works?
Essentially. So the point of here is not to make real-time alerts, because there's not very much you can do with that information. The point here is for you to determine if you develop any symptoms, to make an educated decision about whether those are potentially COVID symptoms because you might have been exposed at some point, or whether they are the flu or some other reason that you might be showing similar symptoms. So that allows you to make an educated decision on whether or not you want to seek medical care. And as we've seen in New York, for example, the health system is completely overwhelmed. There are ships coming in with portable hospitals and freezer trucks used for morgues, right? So that overwhelming of the health system is what we want to provide a way to prevent.
Okay, so let's say I develop a symptom, right? And I go to my app and I see that, wow, lo and behold, I did come in contact, in close proximity to someone that has been infected, right? So, and that would sort of determine that I actually do have the virus, for example, right? Then how does the authority then, sort of trace back to see, for example, the whole 6 degree, for example?
Right. So let me go back to sharing my screen. So let me know if you can see it.
Okay.
But on top of the app, we have a web-based tool that is a completely, again, front-end based tool. So for anyone here that's a technology person, this runs entirely in the browser without any backend server. So the authorities can therefore then load your data from something called your private vault. So Triple Blind builds this private vault. So the private vault is where you keep your most private information in a way that will never be decrypted. So the difference between the private vault and Dropbox or Box is that in Box, you still decrypt the data to do something with it. So here you have a private vault that's on your phone, on your device, never leaves it. And then you selectively can allow a healthcare professional to load it. And in this case, particular example, this is our VP of engineering. You can see sort of the areas where he went, the places where he might have interacted with someone. And then this gives the healthcare professional accurate information as opposed to needing to rely on the person's memory. And with this accurate information, this can then be broadcast in an anonymized way to the other people that have the same device, or the same phone app, so that they can then determine whether they might have crossed paths now with you, who is potentially infected as well.
Okay, cool, wonderful. Okay, all right, Dr. Lau.
Yes.
You want to show some interesting data points from what you've gotten so far?
So, okay. Screen 2.
Okay, let us know when you're ready. Meanwhile, Roger, I'll go back to you on what you mentioned about the situation in the US that is, it's never nowhere near, getting resolved. So let us know why.
From the data they started late, most of the information are not about medical behavior. It's basically a xenophobic reaction against pretty much the rest of the world. So the problem is America has a pre-existing xenophobic narrative that's being pushed throughout almost all its policy. And the COVID virus plays into that. So most Americans don't believe this is something they will get. They associate COVID with non-American. And psychologically, you see this play out in people still going to the beach in mass. The behavior is very consistent with the xenophobic narrative and very inconsistent with reality. And this is why we're seeing all these outbreaks in places that you don't think of as happening. Because when people intentionally throw COVID virus party, you get the consequence you expected from people gathering in closed space. So from the data and from the media reporting, we're seeing exactly what we predicted, that the US containment policy is going to fail. And this is not even taking the factor that America has 50 states. Every state have different policy. The problem is all 50 states are not shutting down in synchronicity, which means this state will have a drastic behavior. Well, this won't. When state A recovers, state will be in the bloom of the epidemic. So they're just passing the virus back and forth. Unless there's a much better concerted coordination. I think DAS's prediction of 70% is actually being optimistic.
Okay, we will come back to DAS to get a feel of what's on the ground in the US. I think Dr. Lau is ready with the slide, yes?
Yep.
Okay.
So this
Tell
one you
us
can
what
see.
we're seeing here.
So this is the main site of Corona Tracker. So you can see that we track news articles of all sort of languages, and also we have user interface from different languages as well. So compared to like social media, like what Rogers is tracking, right? You can see, Roger, your system must have captured this one, right? Doraemon, for some unknown reasons, Doraemon becomes the hottest keyword in Malaysia yesterday.
Yeah.
Yeah. So social media is in a way that it shows you the public response, but what Corona Tracker wants to do, we sort of I position ourselves more like a subway type of thing, right? So we are not going out to tell you that junk food is bad, stop spreading fake news. Especially the main thing that we are trying to deal with coronavirus at the very beginning is actually I wouldn't say elderly, but people who are above 40 years old. From our data, it shows that 45 and above heavy WhatsApp users, they start to spread whatever they seen. Instead of blaming them, saying that hey, you shouldn't be spreading fake news, you should stop it. But we are telling them that look, you have another healthier option, which is a website like Corona Tracker, where you can find reliable news and you can get your fact check if you want to. So the very first thing that we do, in fact, is our USP compared to other dashboards out there, is the ability to track news. So we track different types of news articles, and we use very simple natural language processing to filter news, and we do keyword matching so that to make sure the news is relevant to your country. So you can see that we capture all sort of news here. And then when you click into individual countries, let's say Netherlands. So you will see all sort of interesting facts, cases in ICU, cases receiving treatments, and yeah, every country gets their own version of their dashboard here. So the interesting things that we found is we're doing like what Roger is doing, is we give this information to all the MOH or DOH in every countries for free, and we tell them that a lot of the countries, for example, Malaysia, they only rely on social media to publish their official stats, and then you go to their official website. It takes a while, and then sometimes the data that you've gotten is in the form of PDF files. Sometimes it's in the form of infographics. People make it nicer to consume, to digest on social media, which is good, right? Which is good from a public point of view. But from a data scientist standpoint, this is very difficult for us to analyze the data as well. So we do have open API. Yeah. So we have a well-documented APIs at the api.coronatracker.com. Everybody is welcome to link to our website, get the data in JSON form. So I think this is the couple of reasons, if I were to talk about it, right? The openness, and then the ability to capture both structured and unstructured data and make it available to the public is one of the main reasons we are able to grow into the top 3 coronavirus tracking site in the world right now. Yeah.
Okay, wonderful.
Incredible.
Okay, we finished with the deck.
I think that's about it. That's from my side. So you have worldwide side, you have analytics side, and then in version 2 we have individual tabs for each of the country. In terms of statistics, I think everybody is more than welcome to come here and take a look at the numbers. From our research standpoint, we are interested to know a couple of different things. A lot of people are trying to do this to model the spread using some using naive exponential model, some using more advanced like SER model, which is good. But in terms of combating and fighting the virus, I think what is more important is the other side of the story. Is you have to look at, for example, countries like UK, Dutch. Why do they have so many death cases but so little recovery cases, right? UK and Dutch, and also Turkey's. We spotted trends like this, and also there are other countries, for example, in East Africa and East European, they actually use some of the country. I cannot name who, but you can find them on our social media, on our Facebook. They actually use Corona Tracker data because we crowdsource it from the volunteers. We have 2,500 volunteers helping us to check the numbers and update the numbers every minute. They use that numbers to go and report to their government and say, look, why is this website saying that we have 7 cases, but your official announcement say there's 0? And this happens to many countries. And yeah, I think we're doing some sort of social good in that aspect as well. That's all from my end.
I understand in the beginning, you only had a few resources to tap your information from. But I think over the last couple of months, you have more and more people that are more willing to open up their database to you, so that you're able to do a more studied approach for
Correct.
Corona tracker. Do you see this trend sort of growing? Do you see this as something where different governments and authorities are more willing to submit information to share?
Yes, definitely. So at first we thought that people don't trust us is because we aren't. When we spoke to Microsoft, right? When we spoke to Microsoft and Google, we asked for credits, and then they said no, we can't help you because you are neither an organization, you're neither a startup. So I don't know which angle that I can come in to give you credits and help. So luckily, and we have AWS who kindly support us from day one. So a bit of commercial ads here, but that aside, right? That aside. So it sort of explained my situation here is that we're in an awkward position. We are a group of 2005 people, and in the core team we have 6-7 leaders leading about 200 core members working at the project day and night, because we work around different time zones, right? But the funny part, like Bobby said, is then people. How should people trust you? They can't call you an NGO. They can't call you
Right.
a startup in India. So luckily, we managed to publish a paper on WHO, and we have been using that as a confidence boost, right? To tell people that look, we are legit, we are recognized by WHO. So people start to work with us, and we look at the statistics from Google Analytics. We realize that it's not really the recognition or anything. It's about the language. So the bounce rate of a particular language that's very high when that happens. So we look at GA, Google Analytics, and then we fix that. So we start to introduce different language like Vietnamese, Arabic, and also Japanese and Bahasa Indonesia. These are the ones that we saw high traffic, meaning that they search for the keywords, but the bounce rate is high. And yeah, after we have introduced different UI languages, and that problem sort of go away. Back to Bobby's question, yes. So more and more governments and DOH, MOH are willing to work with us. Yeah, we will teach them, right? The easiest way will be giving them a Google spreadsheet and say, look, you just need to enter a number here, and then we'll get the data from there. Otherwise, if they require any sort of more technical integrations, we're more than happy to assist them.
Okay, wonderful. Great stuff. I've been a big fan of what you're doing since literally day one, and I'm really glad that people are taking you seriously now. And then on that point, I also want to reflect, and I think this is something that I think Roger and Dr. Lau are very familiar with, especially with you being with Magic some years ago, is that there's somehow very little trust for a startup in doing what they're doing. And it's almost like you got to prove yourself, way beyond the limit before anyone can say, all right, you're good enough. I remember back in those days where people would just say, I'll take Uber instead of Grab because Uber has a so-called better name. But then in the end, you realize that, Grab actually become, I suppose, they're more ingrained with the grassroots. So thank you very much for presenting it. Das, back to you. What's the on-ground feel like? As what Roger has mentioned earlier, what's your take on that? And hang on, I'm just going to also post a question from Jeffrey Payne of Golden Gate Ventures. Okay, and you can some of you can answer later. So Das, please take away.
All right.
I'm just going to get my charger. Yeah, please continue.
So it's a little unreal here. There's a little bit of echo. Anyway, if you hear any echo, stop me and I'll try to figure out what's going on. So it's a little unreal, the situation on the ground here, because you certainly see quite a few people taking it seriously. I mean, I'm in Kansas City, right in the middle of the country. You see very different behavior in California versus New York. Technically, COVID came to California before it did to New York. It came to New York. But what you see today is California acted decisively in a way that encouraged people to stay home, as well as the population there just generally took it more seriously as opposed to the population in New York. And we've seen different hypotheses there. But part of why that might be the case is because California works much more closely with China than do most New Yorkers. And so the perception of China as some kind of a haven for wet markets that does not know how to control an epidemic was probably a big behavioral reason why, right? As opposed to in California. For example, I worked for a long time in China with Alibaba and others, and I knew when to take it seriously. And whereas most people don't have that frame of reference as to what China's been like the last few years. In Kansas City now, it's really unreal because we're under a shelter-in-place order. What that means is you're encouraged to stay home. Essential businesses are running, but non-essential like business activity is shut down. But you go to the store and you feel like nothing's happening. You drive around and people are still out and about, driving to the park, for recreational things. So I feel like it's going to be a very long and protracted situation in the United States where communities that have been hard hit today will learn how to take better precautions when this does come back in the fall. We heard the White House today say that they will be better prepared for the second outbreak, the second wave in the fall. And I think while that will be true for a lot of areas in the United States, I don't think that will be universally true for the entire country. So therefore, we stand the challenge of now, therefore, educating people who believe that this is a hoax, this is a political stunt of some sort, and not a disease that is killing people, or even if it's not killing them, it's seriously causing serious danger, harm to their health. Outside of the three areas that I just mentioned, you see a very polarized reaction. Right before the call, I was chatting with Roger, and he talked about the particular pastor in Florida that was just arrested for hosting Sunday services. That is unfortunately not an out of the world thing to happen in today's environment. There is certainly this narrative that this is a Democratic hoax, and the Republicans the Republican governors are not necessarily acting in the ways that you would expect them to, given the nature of this outbreak. And that really is worrisome for me.
Okay. Wow. Yep. Anyone want to add to that?
What people don't realize is, like AIDS, COVID is 100% stoppable without ever developing a vaccine. We just have to change our behavior. That's it. It's just that simple. We can eradicate AIDS and COVID without ever developing any medical counteroffensive if we just change our behavior. The epidemic is not accelerated by the virus. The virus mutation is slow. There's only 2 strands. The epidemic is accelerated by human being, and the biggest factor is politics. Politics is causing the epidemic, not the virus. The virus is just the agent. The causal factor is politics.
Okay. Has everyone seen the question from Jeffrey Payne?
Yeah.
Enforcement. Okay, I think the second question is more interesting. So basically, he's asking to really predict which country or countries will flatten and rebound.
Sure.
So yeah,
we have the data.
I think Rogers hit the nail on the head, where this is a cultural, socioeconomic, and political situation. The hypothesis as to why, say, for example, you can see a distinction between communities that are still hands as opposed to communities that have stopped shaking hands, right, as a result of the epidemic. And we saw that in the UK. Boris Johnson was going around shaking everybody's hand as if nothing was out of the ordinary. And sadly, he caught the virus, right? So I believe that the number of beds per 1,000 people is an important metric, but I don't necessarily know that that is enough of a data point that can be utilized in a way to predict how long the crisis will last. Flattening the curve does involve, unfortunately, while it prevents the overload of the health system and ensures that more people survive, it does make it a longer crisis. And we just don't, I believe we don't have enough data to know whether it will even come back in the fall.
So to answer Jeffrey's question, I can say that from the social data, we can know which government is effective in managing the behavior and emotion of the citizen. And so the precondition for rebound, we can predict from the data. The rebound is it's a very complicated economic and logistic issue that we can't answer with social data. But I can tell you Vietnam and Taiwan will be ready when a rebound occurs because the people are more compliant. We're getting very stable emotional behavior, and they took early prevention. Those two are going to rebound for sure. Indonesia, India, Thailand, Malaysia, I'm very concerned because I have friends there, and the data suggests that the communication and compliance is nowhere in line in order for the society to solve that problem. I hope I'm wrong. I really hope I'm wrong.
Well, yeah, sort of caught in a conundrum, right? That if your system is that good, then you're going to be right, and then everyone is going to suffer. But then if you're wrong, then your system is really not that accurate. So either
I'm okay with my system being wrong in this case.
Exactly. From our bottom of our hearts,
it's mass death. It's mass death.
Yes. Yeah, I understand. Yeah. So basically, it's almost like I can feel that you're looking at your data, and you're sort of caught between a hard place and a stone and a hard place, right? So
yeah, you see the data, you say they're setting themselves on fire, and then they set themselves on fire. It's like my prediction is useless because I couldn't stop them.
Yeah. So it'd be quite interesting, actually. After this broadcast, yourself and Dr. Lau, you guys can actually compare data and see, the kind of trend line. And if you're able to come up with, some significant trend lines, I would love to have it. And then, I can post it along with the video that we are doing right now. Sure. Dr. Lau?
Yes.
To the point of the question from Jeffrey.
Okay, so let me paste a link here.
Again,
yeah. Okay. Well, Jeffrey and I we had a brief discussion on this topic the other day as well.
Fantastic! Yeah.
Our research team is actually looking at that, but right now it's very hard for us to gather that sort of data. And like I pasted a link there. This is the one from US, and some of the projections and predictions as how much resources and healthcare facilities are required in order to at least flatten the curve. And from the case of Malaysia, right, for example, we were expecting that since we have taken some stricter preventive measures for the past 2 weeks and MCO in place, the daily growth rate, at least it should come down. So if it doesn't, it could mean a few things. Number one, it could be MCO is working, but it takes a much longer time to see the effect, and meaning that we have not properly tested all the people that we should be tested because of the limitation of number of test kits. For example, a lot of countries, let's say people credit to like South Korea, right, and their effectiveness because they're able to test as many people as they can. I believe that Taiwan and Singapore have done so as well. So like what Das has said, it's not so much about really just to measure the number of beds or your facilities that can support that sort of treating that many patients or not. But really, it comes down to how much data that we have in hand and how many people we can test as soon as possible. And we have even, right, Roger is fine that his system is wrong, but that is only one part of the equation, meaning that we're looking at the public responses and how government is managing the behavior. There are a lot of other complexities in these equations that is beyond our knowledge. That's my point.
Okay, right. So right now we're dealing with what's ahead of us, right? As in, flattening the curve, getting at least the infection contained. But then there's a social issue thereafter. Do you think that this whole let's say post-containment, right? Will there be issues of stigmatism with victims, like how the AIDS epidemic, for example?
So we think data will help again there. We're working with the Mayo Clinic as well as several other leading hospitals in North America to put together a textile-based continuous monitoring system. So, for example, the concern today is a hospital does not know which one of their healthcare workers is safe to come to work, right? And so what they're doing is they're asking you, check your temperature in the morning, check your temperature in the middle of the day, check your temperature several times, check other vitals, and report back as to whether you might have developed any systems. I think we'll start to see wearables. We'll start to see textiles, smart textiles, adopt and be used to be able to predict whether or not just predict, but also accurately determine that you've actually countered the virus. So we can take a data-driven approach, not just in hospitals, but also in the factories, in the essential industries, as well as manufacturing sectors and the restaurant industry, to determine that we've indeed come through the worst of the epidemic. There are, however, broader social and behavioral issues at play here. We've seen beyond quantitatively determining that someone is safe, it doesn't change someone's, sadly, racist opinions about a person, right? And we've seen in the United States examples of violent behavior against very talented students that are attending our universities here. And I'm really saddened by that, and I'm alarmed by that. Sadly, I think one of the consequences of this is, in the long term, we're going to see a depression of global socioeconomic activity as countries start to look inward. There's already talk being made about countries should make crucial medicines by themselves. Countries should make toilet paper, for all God's sake, in their own country. And those are just early signs of this whole epidemic leading to an accelerating already an inward-looking trend that is seen and felt globally right now.
What about in Asia? What do you think?
I think the next 2 years, the best campaign slogan is going to be somebody else caused a problem. I think xenophobia, nativism will be the key political push. And what people don't realize is stigma is survivable, but reduced lung capacity. Some people is going to be crippled for life. You're going to have large segment of your society are going to be permanently dependent on medical support. And most countries are not ready to do that. They haven't thought beyond, okay, yeah, let's cure the virus, but then you have 30%, 60%, 50% less lung capacity. What are you going to do when 10, 20, 30% of your workforce can't work because they can't breathe? So that's one thing. Second thing you think about, a lot of countries depends on overseas foreign worker for their economy. What happened when the Philippines can't send their worker abroad to work? So people aren't thinking about the second, third order effects yet, but they are coming. There is not politically avoidable. And 60,000 Malaysians go to 60,000 or 300,000 go to Malaysia, go to Singapore every day to work. That's going to change.
300,000.
So you're not even thinking about, politicians aren't even thinking about what's going to happen 12 months from now. They're thinking, how do I survive for the next 2 months? And the chaos is huge. It's actually better for us if we have zombies right now, because that will reinforce social distancing. So people who are not scared about COVID virus are not living the real world.
Okay, so I remember during back in 2003, during the SARS epidemic, I didn't feel this nervousness around. We knew, if I remember correctly, we knew that there was a viral epidemic going on, but there was no nervousness, fear, for example. And we just take the usual precaution, right? There wasn't like a sort of a blanket that was put over the entire global society, right? And this time round, I felt like there's this blanket that's been put over global society, and the blanket sort of is blanketing every countries in at different speed, for example. And if you look at China, it's like, okay, finally we open our doors, right, to work into life. It's almost like this blanket got lifted up, right? And so with that happening, then but back then we never look at people and say that, hey, you got the SARS, you recovered, but you got the SARS, right? I mean, we didn't know who got SARS and who didn't, who got infected, who didn't, right? We read about people dying of SARS, which was obviously a lot more dangerous from an infectious standpoint to COVID-19. But this time around, I felt that there's this overhanging stigmatism to victims of COVID-19. I mean, well, I'm sure people will forget quite soon, but it's almost like you're walking around carrying this disease, so to speak. And how is that going to say? Are you going to sort of carry a piece of paper everywhere you go along with your passport to say that, hey, you know what, I'm cured, I'm negative, and it's not recurring? Do you think this is going to completely change the face of travel?
Oh, absolutely. I think you're going to see in the next couple of months, startup trying to create an antibody passport system, probably a blockchain system where your antibody record is encoded, and some country will demand you using this kind of antibody passport to travel. It's not impossible ASEAN or a common market like EU will mandate travel within, because EU has no border. You may have to have an antibody passport in addition to your national passport to travel, because people think you're a viral agent.
And even more interestingly is to think about this in the context of the other, if you will, symptoms of ignorance that you see in the United States. Like, for example, vaccine denial is a real issue. Measles was making a comeback last year, right? The number of people believing that vaccines are some kind of government mind control, nefarious conspiracy are just on the rise, right? So what happens to those people is an important thing to also consider. Does this virus and this epidemic amplify those concerns, therefore creating in people a fear of modern medicine? Or do they come back to the drawing board and say, you know what, I've seen the disasters of an epidemic and I will do my part in building herd immunity? And given the top-down versus bottom-up nature of Asia versus the Western world, there is a very serious possibility that the Western world will go towards this conspiracy-laden theory of this was a bioweapon from some other country that we don't trust, and therefore it is intended to, the U.S. government allowed for it to happen so that they may vaccinate us, for God's sake, and I'm just spitballing here, but I wouldn't bat an eyelid if some of those news stories started circulating a few months after this epidemic was done with.
It's actually in the news already. They're talking, and that's why there's this sort of, finger pointing as to where this whole, where was ground zero, the actual real ground zero.
Right.
We actually did a study for Farsi. The top 5 news items in the Farsi language speaking social media, top 3 were fake cures. The 4th most viral item, this is like 250,000 share, was Russian Today reporting that China says COVID-19 is a US bioweapon. This is the 4th, was 500,000 share. Most popular, most widely shared content in the Farsi-speaking world. So intentional information operation plays into the what Bias Das says. It's going to unsettle the world, and people forget fake news and information operation is the real danger, because Ronald Reagan used to call the Russian Federation the evil empire. So often, Russians actually thought the United States was going to invade it. They had military plan to counter. So this is a political speech in the United States, triggering a military preparation for an attack in Russia. Fake news has real consequences because it affects people's perception and behavior. it's not out of the norm to think U.S. and China can go to war over this claim, aided by other countries who want to see that.
And to amplify that, it comes at a particularly precarious time for given the political discourse already. I became a venture capitalist for Alibaba out of Kansas City, just as Trump came into office, right? In 2017, I was tasked with investing Alibaba's money in American startups. And I was very unsuccessful in the United States, which is why I ended up living in Israel and doing a lot of investments in Eastern Europe and Israel, right? And that was just a purely a reaction to Donald Trump's presidency and his rhetoric against China. And that, at the time, was not the popular rhetoric, right? Donald Trump was trying to make China the enemy, was trying to paint China as the enemy, but the population didn't necessarily, I believe that the majority of the population didn't necessarily buy that or believe that. What we see today is some of those supporters of our president, sadly, starting to really believe that China is the global enemy because they released a bioweapon. They are causing all of our unemployment issues, not the lack of education or the lack of right training and all the other issues that we have in the United States today. And sadly, the second, third order effects of that are much more profound and to be honest, terrifying.
Okay, a shout out to Psychit from Captive Ventures, who's got a question posted. I think this is interesting that, if someone could, say, put together some data. What do you think, Dr. Lau? I mean, this is something more towards coronatracker.com.
Yes, so the research team we do keep track of different indicators, economic factors, etc. But from the front end side, basically from the coronatracker.com point of view, we don't publish those data because whatever we put out on the site, we want to make sure that it's available to all 195 countries. So most of the time, the sort of open data that we can gather are either from US, Taiwan, Korea, Singapore. For those countries who have diligently collected the data and then they publish those data. But we do try our best. This morning I had another call from NIH as well, is that, for example, we need to look at the distributions and like Psychit and Jeff have been saying, the number of vaccines and then the adoption, etc. All these will play a significant role. But to our audience, right? If you would like to know more about that sort of data, you can join our research team, and then we'll share the results and research progress with you. Not a problem. It's just that we don't publish them on the websites because we whatever we publish there, we want to make sure that it's available and relevant to 195 countries.
Wonderful. Okay. Look, this has been really wonderful. The conversation is going to get endless, and it's approaching to the end. Well, it's not the end, but I'm sure you guys will be very busy with other things. So before we go, now that what you guys are doing is directly related to the current pandemic. Now, let's say post-pandemic, right? What can your platform continue doing in relation to the virus?
So a pandemic government should not be an everyday government. Let's start there. A government does have the onus of responsibility to respond to pandemics in a decisive way. And it leads to an expansion of the government. And history has shown us that governments, when they expand, they rarely contract in a similar way. So therefore, this will lead to a permanent enlarging of government responsibilities. Hopefully some of that is good. Hopefully we give care to the people that need it. Hopefully we're able to, as a society and as a world, overcome the worst effects of this pandemic. However, it should be important to know that we do not have to sacrifice our civil liberties forever to be just able to deal with a pandemic of this nature or otherwise. So what I'm working on is the ability to build all the right technology solutions to be able to do all the things that the governments would like to do to be able to control a pandemic without that leading to a slippery slope of permanent surveillance state. Beyond that, I believe there is a lot that the tech community at large can do to enable the world post coronavirus to come back up to its fullest steam. I think the tech industry can provide a lot of economic opportunity for the displaced workers. I think there is an opportunity here as consumer behavior preferences change in a fairly dramatic way for new and novel innovations to come to market, as well as enable the world to go back to work once it's safe to go back to world again, go back to work again. There is an economic cost to this pandemic that is very, very severe, especially to the downtrodden and the worst hit are unfortunately the people that have the least amount of ability, financial cushion wise, to be able to deal with this. So therefore, let's think about the broader world as well.
One of the things that's unique about Taiwan is every year we have typhoon. So the society is always ready for disaster. This is what I see in other countries. They think they can solve disaster with just-in-time supplies and resource. As a result, they neglect the fundamental infrastructure to deliver those. Taiwan's medical system, universal healthcare, disaster preparation, use of military to augment auxiliary. It's like we're under a state of constant siege, both by resource as well as information operation. Before the pandemic, we're helping the government monitor fake medical remedies, false medical claims. So the government needs to understand something needs to be consistently monitored. I'm not going to lift 500 pounds tomorrow and become healthy. It takes every single day. You got to do something. So this should be a wake-up call for a lot of government that you need to have a stable infrastructure to handle these kind of black swans. And you just can't depend on money or talent to supplement the fact that you're not funding critical infrastructure. US is going to see a huge deficit in infrastructure for healthcare, communication, even the basic ability to manage their people. That's the biggest havoc COVID is going to wreak in the United States. All the flaw in the infrastructure, lack of preparation, lack of funding will come through. People will die because the government haven't been paying attention to this. Just like 9/11, people were asking for secure cockpit way before 9/11, yet 9/11 still occurred because a simple metal door wasn't placed on the airplane cockpit. And all the government is going to, unfortunately, most government won't pay a huge penalty for being unprepared. But there are a few government who will use a system like us, like DOSs, like Dr. Laos, to maintain their level of preparedness. And that's resiliency, having resource when you don't need it.
Dr. Lau?
Yep. So, like I mentioned at the beginning of the this live show, is that Corona Tracker, as the name says, right, will live up to the name to keep track of all sort of coronaviruses, like not just the COVID-19, right? COVID-19 is just one of the latest member to the corona family, but we have a lot of other viruses. And not to be forgotten is that people has been talking about there are a lot of different variations and mutations of the current COVID-19. So it's definitely worth the work, even though if, let's say, or if we all agree, although we might not, is that if WHO officially announced that the pandemic is over now, everybody sort of like go back to the normal stage, we will still continue to work. But on the other hand, right, on the public side, on the I'm not so much into the politics side of the entire pandemic, but it's more on the public health and also decision making process and policy making side, right? All the governments should look at how do we work together to make whatever data that there must be a common factor that everybody sort of agree, right? This is the amount of data that we are willing to share, we are willing to publish, and we use this opportunity and, like Roger said, right, coronatracker.com platform as a general framework for everybody to work on, and then we contribute to this common knowledge base, and this will help a lot of the countries. See, even in this situation, the developed nations are not even prepared. So how can we make faster decision and react better the next time when similar viruses hit us? Thank you.
It's really interesting that, whatever we are doing, it takes a virus to pretty much flatten what we know about life. And there's almost this reset to how we understand business being done. Again, as what Dr. Lau said, should WHO declares that this pandemic is over, we're going to see completely different landscape in different continents. Look, like I said, we can continue on and on and on, but you guys are really busy guys, so I'm going to let you off. So thank you very much for joining this broadcast. I'm sure there are listeners out there that can refer some of your work to other people, more important agencies, and I'm sure you guys are on the ready to jump on the opportunity to help other countries that otherwise do not have the help from. Okay, so to all listeners, thanks for joining.
Thank you so much.
And just a reminder, there will be another podcast tomorrow afternoon, 2 p.m. with 3 VCs. So see you tomorrow, and hopefully we are able to learn something valuable from our 3 speakers, Dr. Lau, Das, and Roger Do. Thank you very much again. See you soon.
Thank you so much.
Bye.
Take care.
Thank you so much
Take care.
for having us. Thank
safe.
you.